A 34-year-old patient presents with progressive shortness of breath and sudden pleuritic chest pain. I am showing you two axial high-resolution chest computed tomography images. Describe the findings.
The high-resolution chest computed tomography images demonstrate a pneumothorax and numerous thin-walled, regular, round cysts distributed symmetrically and diffusely throughout both lungs, involving the costophrenic angles. The intervening lung parenchyma between the cysts appears entirely normal.
Based on these imaging findings, what is your primary diagnosis and the key diagnostic features shown?
The primary diagnosis is lymphangioleiomyomatosis, commonly known as LAM. The key diagnostic features are the symmetrical, thin-walled, uniform round cysts with normal intervening lung parenchyma, and the associated spontaneous pneumothorax.
If I tell you the patient has a history of recurrent pneumothoraces and is currently in her reproductive years, how does this clinical demographic support the diagnosis?
LAM occurs almost exclusively in females of reproductive age, typically presenting in their 30s. Spontaneous pneumothorax due to cyst rupture is a very common presentation, affecting up to 80% of patients during their lifetime.
Is LAM associated with cigarette smoking?
No, LAM has no association with cigarette smoking, which is a key clinical differentiator from other cystic lung diseases.
Name two common pleural complications of LAM.
The two common pleural complications are spontaneous pneumothorax and chylous pleural effusion, or chylothorax, which is caused by lymphatic obstruction.
What is the primary differential diagnosis for diffuse cystic lung disease on high-resolution computed tomography, and how do you differentiate it from LAM?
The main differential is Langerhans cell histiocytosis, or LCH. LCH is strongly associated with smoking, features bizarre or irregular branching cysts and nodules, and characteristically spares the costophrenic angles. LAM cysts are uniform and round, without nodules, and involve the costophrenic angles.
What immunohistochemical marker is highly specific for the smooth muscle-like cells in LAM?
The GP100 antibody, known as HMB45, is highly specific for LAM cells, which also characteristically express progesterone and estrogen receptors.
Identify the classic genetic syndrome associated with LAM and the mutated genes responsible.
LAM is associated with tuberous sclerosis complex. It is caused by inactivating mutations in the TSC1 or TSC2 genes, leading to hyperactivation of the mammalian target of rapamycin, or mTOR, pathway.
State the critical safety warnings and contraindications for a patient diagnosed with LAM.
The critical safety warnings are that pregnancy can cause rapid disease acceleration, and estrogen-containing medications, such as combined oral contraceptives, are strictly contraindicated as they stimulate LAM cell proliferation. There is also a risk of renal angiomyolipoma rupture.
What are the immediate clinical management recommendations for this patient?
I would recommend immediate chest tube insertion or aspiration for the acute pneumothorax. Initiate the mTOR inhibitor sirolimus to stabilize lung function. Obtain abdominal imaging to screen for renal angiomyolipomas, and refer to pulmonology. Refer to pulmonary medicine